Dear all, I'm going to proceed with the presentation of my dissertation on the topic of the role of real estate market on residents' mental health, a comparison through 29 provinces and cities in China. I'll introduce it from 4 aspects. And this is my author introduction. I'm from Shanghai, China, and I'm studying in Tongji University, major in urban design. I've been involved in the construction of several physical urban design projects, as well as participating in several urban design projects, and has been in the real estate industry for 1 year. So this is the contents. 1. Introduction. 2nd. Method. 3rd. Results. 4th. Conclusion. First, introduction. The theoretical definition of psychological well-being in urban design. The psychological impact of cities on people has been explored since the 1950s, with Jane Jacobs' book titled The Death and Life of Great American Cities indicated the negative impact on mental health of modern urban planning on groups and individuals, and advocated for small mixed-use communities. The emergence of environmental psychology in the 1970s led to a search for interaction between humane and psychologically friendly urban environment design. With the subsequent introduction and popularization of sustainable development, urban planning has begun to incorporate elements of green space, public transportation, and community building to improve the quality of life and psychological well-being of residents. Kaplan's restorative theory, proposed by Rachel Kaplan and Stephen Kaplan in 1989, posits that natural environments have a positive impact on restoring and replenishing mental fatigue. It suggests that elements of the natural environment such as trees, bodies of water, and expansive vistas capture attention, reduce stress and fatigue, and promote emotional and cognitive restoration after prolonged periods of focus on cognitive tasks. In addition, Ulrich's stress recovery theory suggests that natural environments can even help individuals alleviate stress and restore mental and physical well-being. In addition to these 2 typical theories, ecological psychology, psychogeography, and cognitive studies interpreted the relationship between human and urban environment in different perspectives. Second, why developing psychologically friendly cities is crucial to the society nowadays. Psychologically friendly cities have been developed for decades and have become an inevitable trend in today's society. According to the data from WHO, globally, 1 in 8 people experience a mental health condition, with depression and anxiety among the most common, and in 2019, 970 million people globally were living with a mental disorder, with anxiety and depression the most common. What's more, people with severe mental health conditions die 10 to 20 years earlier than the general population. The Mental Health Action Plan 2013 to 2020, published by WHO, proposed a series of strategies and actions to improve urban environments to promote mental health. Third, a literature review of economic factors on the mental health of the population, taking house prices as an example. The city's environment rates, housing prices, public services, and welfare can fluctuate the mental health of its residents. Among those factors, house price is the dominant one. Heidier Atlee, Rebecca Edwards, and Betty Y.J. Liu conducted research in 2017 is examining the impact of house price fluctuations on health, utilizing data from the Household Income and Labor Dynamics in Australia survey with a sample of approximately 19,000 individuals. Another study proposed by Jae-Won Wu and Jae-Soo Lee in 2020 emphasizes the importance of inclusive policy strategies to improve the environmental quality of public rental housing. Moreover, Song-Man Kan, Han-Lim Soon, and B.K. Song investigates the impact of local housing price inequality on mental health in South Korea. utilizing comprehensive data, including all housing transactions in South Korea and individual-level medical records. The research uncovers a significant relationship between increasing local housing price inequality and the likelihood of individuals seeking medical attention for mental health conditions. Second, methods. 1. Quantifying psycho-emotional values and counting resources of mental health institutions. We counted all mental health institutions in 29 provinces in China in 2023. Medical and health institutions providing diagnosis and treatment of mental disorders, psychotherapy, or psychiatric rehabilitation services approved and registered by the health administrative departments. The scope of the statistic is psychiatric hospitals, general hospitals, rehabilitation hospitals, primary healthcare institutions, psychiatric outpatient clinics, and comprehensive outpatient clinics. Second, collection of data on real estate development in the provinces. We have collected data the extent of real estate development in 29 provinces in China in 2023. Data related to real estate development include the average unit price, average total price, average household size, total number of listings, total square of footage of listings, and the total market value of the real estate market on the provinces. State statistics are based on listings listed for sale in the market in each province in 2023. Second, developing the correlation model. We construct multiple linear regression model like the PPT shows. The statistical correlation analysis starts from the classic multiple linear regression analysis, where psycho-emotional value is the median psycho-emotional values by province. The model includes the average unit price, average total price, average household price, total number of listings, total square footage of listings, and the total market value of the real estate market in the province metrics as the predictor variables. As the basis of any further correlation analysis, MLR model was firstly constructed based on the variable subset we calculated and collected. There will be still dozens of candidate variables were still involved as the potential predictors. Then a subset of predictor variables was further refined by adopting the following rules. Only variables with a p-value smaller than 0.001 and VIF smaller than 3 in the MLR model will be included. Third, results. First, statistical report. We have collected data on houses prices and the extent of real estate development in 29 provinces in China in 2023, as well as data on psycho-emotional value and mental resources in each province. The psycho-emotional value is measured based on the ability to control and regulate emotions, which means the more stable the mental state and the more capable of controlling emotions, the lower the number is. The psycho-emotional value is divided into 6 grades of 1.025, 1.475, 1.925, 2.375, 2.825, and 3.275 by taking the median value of each province. House prices in each province generally decrease gradually from the coast to the interior, and the total number of units varies according to the size and development level of different cities. The psycho-social value is taken as the median value of each province, and the psycho-social value of the southeastern provinces of China is generally lower than that of the northwestern provinces. From the data descriptive statistics, the overall average house price per unit in each province is 16,597, with a standard deviation of 15,786. The overall average of the average total price per unit in each province is 174, with a standard deviation of 154. For psychological data, the median psychological mood value was 2.11 with a standard deviation of 0.653. The number of mental health facilities in each province was 191.48. Second, correlation analysis. For the above data, we first did a correlation analysis. As shown in the figure 1 below, for the median psycho-emotional value, we find that it has a significant negative correlation with the total number of units in each province. The more units there are, the lower the psycho-emotional value, and the better the mental state. For the number of mental health facilities in each province, it was found to have a highly significant positive relation with the total number of units, total area, and total market. The higher the total number of units, the higher the total area, the higher the total market value, and the higher the number of mental health facilities will be. 4. Conclusion. The study dives into the complex relationship between house prices and the mental health of urban residents by analyzing data from 29 provinces in China. We observed that real estate market dynamics significantly affect residents' mental health. Correlation analysis showed that increases in total housing stock and total market value are positively associated with the number of mental health facilities, suggesting that better housing availability supports mental health infrastructure. Conversely, higher unit prices and total square footage were associated with less stable mental stress, suggesting that housing affordability and density are key factors influencing resident well-being. Multiple linear regression analysis further confirmed these findings. Psychological mood values were positively associated with higher unit prices and larger total square footage, emphasizing the psychological stress of expensive and spacious real estate. In contrast, higher total prices and more housing units were associated with better emotional status, highlighting the benefits of affordable housing and diverse real estate supply. These findings emphasize the importance of developing psychologically friendly urban environments. Policymakers should consider these insights to promote mental health through strategy urban planning that balances real estate development with the psychological needs for residents. Specifically, the following strategies as solutions should be emphasized. First, increase the supply of affordable housing. The government should increase the investment in affordable housing programs to ensure that low and middle-income households have access to suitable living conditions. This will not only reduce economic pressure, but also improve the mental health of residents. Optimize land use and planning. Create a more livable urban environment by rationally planning land use, reducing the development of highly density residential areas, and increasing green space and public space. A good living environment helps to reduce residents' psychological stress. Third, strengthen mental health services. Increase mental health service facilities at the community level, such as psychological counseling centers and community health centers, to provide convenient mental health support. Ensure equitable distribution of mental health resources so that all residents can benefit. Fourth, promote community building. Enhance the connection and mutual support among residents through community activities and the building of social support networks. A harmonious community environment enhances residents' psychological well-being and sense of belonging. Next, implement tax and subsidy policies. Provide tax incentives or home purchase subsidies to first-time home buyers and low-income families to reduce the pressure of home purchase and promote the stable development of the housing market. And the last, strengthen regulation and policy guidance. The government should strengthen regulation of the real estate market to prevent excessive increases in housing prices and maintain a healthy and stable market. At the same time, it should formulate housing policies favorable to mental health and encourage developers to build psychologically friendly residential areas. Through the above strategies and measures, the psychological pressure caused by high housing prices can be effectively alleviated and the overall mental health of urban residents can be improved. Future urban development must prioritize affordable housing, equitable distribution of mental health resources, and community building initiatives to foster a healthier and more resilient urban population. Overall, the study deepens the understanding of the economic determinants of mental health and advocates for a holistic approach to urban planning that recognizes mental health as a core component of sustainable development. So that's all my presentation. Thank you.